The 5 community hospitals represent 4% of the provincial health care budget. In our own instance, we are less than 1/2 of 1%. The rural hospitals are not the problem, and they're not the solution. And enough is enough. Let's get this turned around. Thank you.
We are devolving into a 2-tiered system of health care. One for the rich and one for the poor. One for urban islanders and one for rural islanders.
The issue isn't revenues, it's priorities. It's time to rebalance priorities to reflect the reality of the most rural province in Canada. It's time for the falsehood to end that island-wide people live on money provided by the center of power. I have a phone book. Take out the yellow pages. Take out the government pages. Here's Charlottetown. Here's the rest of the island. This has more people in it than this. And we matter. He promised to reopen emergency response to Surrey. Mr. Premier, you stand before us today a changed man.
Closing our acute care beds, reducing the doctors available to us, minimizing the primary care services available to everybody who doesn't live within the confines of this community is not the solution. To share a secret, I like the minister. He's a very fine fellow. But if the minister is truly sincere in wanting for all islanders better access and better care, then he needs to talk with us. PCH will be the major acute care referral hospitals. Let's be perfectly clear here. Prince County Hospital has lost staff, administrative support. It's had pediatrics, emergency surgery, and all general surgery threatened over just the last few years. 4 months before this plan was announced, 4 months before this plan was announced, we were at the table with the minister, fighting the decision of Health PEI that was going to close down emergency surgical services at the Prince County Hospital. Who was going to look after us? Today, for the purpose of selling this plan today, we're now referred to as the major referral hospital. A pillar of acute care. 4 months ago, they were trying to shut us down. Either we were being led astray then, or we're being led astray now.
My priority is to continue to make sure that we have services, that we continue to sustain a system that's under intense pressure, which is no different than any other province in this country. We also have to recognize that we talked about federal governments, and I've made this very clear. I don't spend any time pointing fingers and blaming whether it's the federal government. When we look at federally funded healthcare and this publicly funded healthcare in this country, it was built in the late 50s on 50-cent dollars. Today, that's a lot different than it was. We're functioning on 18 cents in every dollars. The average Canadian age at that time was 27 years of age. Things have changed. The overall health of this province is different. The overall health of the country is different. Technology has changed. The role and the way doctors work has completely changed. The way technology has advanced medicine has changed. But as the minister, I have an ultimate responsibility to look at healthcare equity across. We have closed not a single bed or a single facility in this province.
We're going to make sure that Surrey is going to be contributing to the healthcare system. That Tyne Valley, Prince County Hospital, O'Leary, Alberton. It's about using the resources we have to deliver the healthcare that Islanders need and deserve. This is about us maximizing the resources that we have. Let's take down the silos. You know, it's too bad that we have to have silos in our province around healthcare. What we need is our healthcare system working together to deliver better services. And I believe that this plan will allow that to happen. Obviously, people are going to disagree with me, and I respect your opinions. But I can guarantee you this. At 15, 20 years ago, things changed. In 15 and 20 years, things will change again. But we're going to try and do the best we can for Islanders. Thank you very much.